Hello, everybody. This is Dr. Mark Richards, and I'm answering your questions at NobodyWantsYouHealthy.com. Steve, what do we have today for a question?
Okay, we go to New York with Kathy. Kathy is in her early 40s, and she said that she was a very low-key and nice, easy person to be around earlier, but in the last few years, she finds herself becoming very irritated at things. She's got a lot of anxiety. Her family has noticed it, and she is then went on to some antidepressants. She goes, while they may have affected some areas, it didn't help her anxiety or her mood. So she's getting a little desperate now and wants to know if testosterone therapy might have a chance of a positive effect for this problem.
Okay. Well, Kathy, you may not know this, but this is a very common question I receive in my practice. Women in their late 30s, early 40s, sometimes not until later on, 50, when they hit that low testosterone level, they experience anxiety and irritability. Sometimes it comes out as aggression. Sometimes it comes out as depression. And if it's something they never had in their 20s, then probably it's not what we call endogenous depression. In other words, it's not something where there's a biochemical failure that is ingrained in your system. This is a classic low testosterone mood disorder. And in fact, putting people on testosterone pellet therapy, such as you, very often, extremely often, corrects it and restores them back to much more like they used to be, much more happy, not letting the little things bother them. And of course, that helps your work environment. It helps your family environment. It helps your relationship with your spouse and children. It's really been one of the bigger joys I see in my practice is restoring this sort of function back to people who have lost it. So thank you for your question. I would really encourage you to go talk with your medical doctor about getting your testosterone level and, of course, your estradiol level tested along with other labs such as thyroid and one called FSH, which determines how your menopausal status is. Just remember that the lab ranges for testosterone in women are not the ideal ranges or the good ranges. It's just the average of the sick population that the lab's testing. So generally from the German Women's Health Clinic, we have an understanding that below 25 or so is a severe deficiency in testosterone in women. Below 34 is a moderate deficiency in women. So keep those numbers in mind when you get yours drawn. Remember, there's a lot of individual variation, but it certainly sounds to me like you might well be a candidate for testosterone pellet therapy.